So I noticed my vision was getting worse over a period of time. It was blurry, so I wanted to go and see what the ophthalmologist would recommend for me. My daily tasks were becoming very difficult. Even opening a simple can of tuna and reading the outside packaging was very difficult. My light bulb moment about actually going to the ophthalmologist was when I was travelling for work and I really just could not see my laptop. The print was so small, it was really affecting my professional career.
I've been using multifocal intraocular lenses since 2001. I engaged with it initially to treat cataract patients who were desiring more options than just straight distance vision to enable them to read without glasses as well. And then as the technology's evolved and improved, this has now become applicable for people who are over 45 years of age and simply don't want to use glasses either for distance or for reading.
So my surgeon explained to me when I went that my vision was deteriorating basically to age-related changes to my lens and that it's a natural progression. So my surgeon recommended to me that I was actually a very good candidate for cataract surgery, having some lens implanted in my eyes with the potential of being glasses free, and that's really what I want. I don't want to be reliant on glasses or any visual aid.
Identifying patients who are suitable for this technology is important. You need to carefully evaluate someone's ocular health and also their visual goals. In terms of ocular health, patients who are unsuitable would be if you had existing macular degeneration or other significant ocular pathology, with the exception of cataracts. Cataracts, of course, can be treated with this technology.
At the first appointment with my surgeon, there was a lot of visual testing that had to be done to measure if I was actually a good candidate for cataract surgery and for him to recommend the exact power of lens that I would need. So my surgeon told me that after the surgery I could expect to see well in the distance at my laptop and close up as well, and that was, that's exactly why I went to him in the first place. That's what I wanted. I want to be able to see at all distances clearly. So on the day of the surgery, it was a very seamless procedure. I was in there for maybe 3 or 4 hours, had several drops, in those 3 or 4 hours, went in, had the procedure, finished the procedure, and my son came and collected me and brought me home. And it was actually dark when we left the hospital. The halos around the lights were a lot more intense than I anticipated. So I really had to shut my eyes for maybe 5 minutes of the 15-minute journey home because it was quite intense and very bright.
In terms of side effects, the lenses can cause a haloing effect around lights. There is an incidence of some glare sensitivity that people experience at first sometimes, and a small proportion of people might require a fine-tuning procedure, with, say, for example, laser vision correction. If things aren't quite perfect for distance, then we can tune it up. So these are essentially the minimal side effects that I would need to talk about, but they are transient and don't impact people in the long term.
At my one-day post-op visit, the surgeon checked my vision on the eye chart, as he did before when I went. I was surprised on how well I could see, even with still being a bit blurry, than I could before I had my surgery. I was a few lines up the chart, which was really great to see. He said the surgery was a great success and that he would follow me up in 1 month. After the visit, my son and I went to brunch, and I was so pleased to see that I could actually make out the menu, which I haven't been able to do for a long time. I had to put in drops regularly for about a month. My vision was a little bit hazy but clearer than it was prior to the surgery. So it's now been about a month since my surgery. My vision is really, really clear. I can work on my laptop easily. I can read all the backs of the packets, etc.
I've been using Panoptix since it became available. The lenses will provide you both eyes seeing for distance, both eyes seeing for reading, and both eyes seeing for computers. And by maintaining that binocularity with both eyes working together, you maintain 3D depth perception, and the visual quality is very good due to the fact that you get what I call summation, both eyes working together, which is how the brain is really designed to see.
Overall, for me personally, the benefits far outweighed the risks. My surgeon advised me that, this type of surgery is not for everyone, but I would, sincerely recommend it to my friends if they were suitable candidates. The surgery has impacted my life hugely in a positive way. not just professionally, but on so many different levels. I'm able to go to a restaurant, read a menu and order what I want. I'm able to work on my laptop easily. Socially, I can actually read the race book now. We go to races and I could never actually read the race book, but it's given me a sense of confidence that I can actually see clearly.